Salmonella is a bacteria that is often present in the intestinal tract or in the GI tract. It lives in humans, it can live in animals, and typically when it's shed through the stool and through contaminated water or food is how others can contract it. But it's a bacteria that lives in the intestinal tract. An infection with Salmonella for patients will often appear like a stomach bug or stomach flu type symptoms. People can develop fever, they can develop diarrhea, and abdominal cramping that can be pretty significant for them. We've encouraged people who now have chickens in their backyard or maybe going to some of the farms in the community and visiting is to make sure that they, again, wash their hands after touching the chickens or the ducklings, to also make sure that for those that have it in their home, the footwear that they use or even wearing gloves sometimes and keeping all of that stuff outside of the home and not bringing it into their kitchen or where they eat and drink, because that could increase their chances of exposure. If they develop the diarrheal symptoms or have diarrhea, fever, abdominal cramps from potential exposure to Salmonella, or again have the stomach bug or stomach flu, strongly just encourage people to focus on hydration, make sure they're drinking plenty of fluids. They could consider using some of those medicines that help with slowing down the episodes of diarrhea. I always just caution people that sometimes that can also prolong the illness as well. And that from a need for antibiotics, those are going to be, again, the severe cases. If someone feels they're dehydrated, severely unable to keep fluids down, and they need to seek medical attention or have a condition that compromises their immune system, then they may need antibiotics. But for most of us, this will resolve on its own.